I guess just to start off, I'd love if you could give us some background for our readers who are unfamiliar on the work of the National Women's Law Center, and more specifically, what you do there, as well as what your relationship is to the We Demand More coalition.
Sure. The National Women's Law Center fights for gender justice in policy, in the courts, in states, and in our culture. And so we work with partners across the country, both at the grassroots level as well as nationally, to advance gender and racial justice. And we center and focus on women who face multiple and intersecting forms of discrimination. So especially women of color, LGBTQ women, women with disabilities, et cetera. And my job there is I'm the vice president of income security and childcare and early learning. And so I oversee our work on cutting poverty, on investing in early learning and childcare as both as a work support for women as well as for the childcare workforce.
And what's the relationship exactly with the We Demand More coalition?
So the We Demand More coalition is a coalition of over 70 organizations across the country who have come around a set of 5 demands. And the National Women's Law Center is one of those organizations. One of the roles that we played is we have been working with our partners to draft a letter. It all started with a letter that sort of laid out what we needed in order to really fight this pandemic. And to center the people who are most affected and who are on the front lines, who are disproportionately likely to be laid off, who are doing the lion's share of the caregiving at home, and that's women, and women of color in particular. And so we sort of came together around this letter that NWLC helped to draft. And then from there, we wanted to put some muscle behind it. And we wanted to say, this isn't just a set of demands on paper. It only has life if we insist upon its contents. And so under the amazing leadership of Planned Parenthood Action Fund and Ultraviolet and a number of Moms Rising, a number of other partners who we work with closely, this really took on a new life.
And you already started mentioning this, but can you just speak a little more specifically to what the demands are of the We Demand More coalition?
So we have a range of policy demands, but they're organized thematically under 5 buckets. So the first one is to prioritize our health and safety ahead of corporations. This includes demands such as making sure that we end these carve-outs of paid sick leave and paid family and medical leave. There's no reason why everyone shouldn't have those protections, and they shouldn't continue after this crisis is over. It also includes things like ensuring that that people on the front lines actually have workplace protections and PPE, personal protective equipment, and that basic labor protections like the right to form and join and participate in a union, to file a claim for sexual harassment or discrimination, et cetera, that those rights are protected even in the midst of a pandemic, and especially in the midst of a pandemic. We also under this include things like making sure that people understand that reproductive healthcare, including contraception and abortion, is essential healthcare. And so not just preventing some of the shenanigans that are taking place in terms of governors and lawmakers trying to actively attack women's reproductive healthcare, but affirmatively taking steps to further and expand access to it, both in the United States and around the world. The second provision is to get relief to women and their families now. We've seen women are more likely to be laid off during this time. They're concentrated in sectors like retail, hospitality, restaurant work, et cetera. And we're seeing unprecedented claims of unemployment as well as hardship. And so we're asking under the Get Relief to Women and Their Families Now for just basics, like increase the Supplemental Nutrition Assistance Program, that's formerly known as food stamps, by 15%. Make sure we're expanding resources for rapid rehousing. Make sure that we are actually setting up our unemployment insurance system to be successful, not just during the course of this pandemic, but for the economic pain and suffering that's going to follow it. It includes making sure that women and their families are safe. We know there's a spike in domestic violence. A lot of women are right now trapped at home with their abusers. And so we need to provide $100 million in emergency funding for our sexual assault services programs. We need to make sure that states have the resources that they need to help keep survivors safe. And then we also need to be releasing individuals in jails and prisons and detention centers who pose no public safety risk, and families held by ICE, pregnant women, elderly people, et cetera, there's no reason to keep people subject in these close quarters where they are more likely to be affected by the pandemic.
Many data sources, including by analysis done by The Economist, has shown large increase in the rates of domestic violence since the beginning of lockdowns and stay-at-home orders in the time of COVID-19. So just building on sort of the demands of this coalition, I'm wondering if you can talk about how you see this project of preventing domestic violence working in tandem with the reopening of states and the phase out of pandemic measures. Does that sort of change the actions that different levels of government need to take? And how do you ensure that there's sort of long-term work to create infrastructure mitigating against the surge in domestic violence we've now been seeing during the pandemic?
I would defer to our colleagues at YWCA and other places, National Network to End Domestic Violence, et cetera, on the specifics of the funding streams and what's needed long-term. But part of the reason that we're advocating for SNAP, for affordable housing, for unemployment protections, for workplace protections is so that women can have the economic security and stability that they need in order to be able to be safe. And so that is one way in which this is all interrelated. But again, I would urge you to go deeper with my colleagues who are like true experts in sexual assault and domestic violence.
And you also mentioned reproductive healthcare. And I'm wondering, in the midst of this pandemic, many states have been taking action to effectively ban or severely restrict access to abortion, including by declaring it as a non-essential service. Meanwhile, abortion clinics in states surrounding places with these measures have seen influxes in patients. There are spiking rates of usage of teleabortion or ordering abortion pills through the mail. So I'm wondering how the We Demand More coalition, in addition to addressing this issue as part of your program, is viewing this sort of resurgence of a struggle around abortion as an electoral and political issue in the time of COVID. Why do you think that this struggle is playing out in this way right now, or this sort of partisanship around abortion is coming to head in the time of COVID? And do you think that there are sort of longer term implications based on the action that states are taking right now in the midst of the pandemic to restrict access to reproductive health care and abortion services?
I mean, I think that this is not new. This has been there have been attacks on women's reproductive rights and health and bodily autonomy, for a very long time. And we've seen a trend of during times of crisis, when there is an opportunity to act, I would say that many conservatives who are foes of abortion access would say, don't waste the opportunity. And so I think that's one of the reasons why you're seeing increased attacks on women's reproductive rights and health right now. And what we can do about it, I mean, we need to be actually investing in reproductive health and rights. We right now are also thinking about the Title IX rule that came out today. We're thinking about the birth control case in front of the Supreme Court. All these issues are linked. And so the National Women's Law Center and our partners across the women's movement are very focused also on reproductive justice as it's linked up to a whole range of other issues, because abortion is healthcare. And it shouldn't be stigmatized. It shouldn't be, it shouldn't be, made to be some non-essential service. This is basic women's health care. And right now, when it's under attack, we are not only going to stand arm in arm with Planned Parenthood and with all of our abortion providers, we're going to insist upon full access to and to better access to reproductive health care.
Great, thank you. To move on to another demand that's in the central 5 demand platform of the We Demand Now More coalition, I'm curious about the 5th demand, which is that Congress protect our safety and our right to vote in 2020. Why is protecting women's right to vote such a central tenet of this platform, considering that it seems a bit different from demands around meeting imminent needs in terms of healthcare and economic relief?
Well, I don't think you can talk about economic and healthcare relief without talking about a right to vote. Because the leaders right now who are crafting these responses need to be accountable back to the voters and the people who put them there. And if people are unable to safely vote and unable to safely express their either dissatisfaction or satisfaction with the direction that our lawmakers are taking the country, then all of those things are at risk and up in the air. And so we saw what happened in Wisconsin when people, like there was new COVID cases when people just simply went out to try and exercise a very basic right to vote. So yes, it's a public health issue in the literal sense of that we want people to be able to safely vote. We don't want to spread the virus further, but it's also a public health issue in a much bigger sense, because protecting our democracy, protecting our basic rights and institutions, including the right to vote, is what will allow us to hold our leaders accountable to actually contain this virus and to get us back on strong footing.
And is there anything particular about women's right to vote that is imminently threatened in this time that may be distinct from the broader right to vote, given that women are on the front lines of the pandemic?
Yeah, I mean, if you think about it, like women are more inclined, there's new data showing that women are more inclined to obey social distancing orders than men are. They are more inclined to have caregiving responsibilities that can make it difficult to vote. They are more inclined to basically what the new research shows is that they are much more likely to be wearing masks. They're much more likely to be listening to the social distancing orders. They're much more likely to be doing caregiving at home, really bearing the burden of keeping all of us safe right now. That both means that it's especially important that their voice be heard in November, and also especially important that we are making it as easy as possible for people who may be experiencing barriers.
So I'm curious, looking beyond the current pandemic, what the coalition's vision is for an economy that truly centers women's needs and particularly recognizes the disparate needs of more marginalized communities of women, and also how that economy feels different experientially in comparison to the economic system that we're living in right now during COVID that isn't meeting women's needs in accordance with the coalition's demands.
Right. I mean, I think that COVID has exposed cracks in our system that we've been saying have been there for a long time. Our country doesn't really have a system of supporting caregiving, which is the backbone of our economy. You can't have people go to work if you don't have childcare, if you don't have long-term services and supports, if you don't have someone to care for the sick, the elderly, young children. You can't have parents go to work if there's not teachers and principals and school staff who are leading public schools. You're not going to have basic state and local government services. The majority of those workers are women and people of color. And so many of the services that we rely on are done by women who are underpaid, overworked, and not valued. And so right now, women are on the front lines of this crisis. We are literally saving the country. We're 75% of healthcare workers, we're 2/3 of the grocery clerks, we're over 90% of the childcare workers, which includes for the frontline workers so that they can go in. And I think that in the aftermath of, or the other side of this pandemic, it's not okay just to go back to a system where women are making, 81 cents on the dollar of men. It's not okay to go back to a system where Black women, Latinx women, Native women, Asian Pacific Islander women are all making significantly less than white men, and there's not just gender but racial disparities. We're not going to go back to a system where the women who care for our children and our parents are paid poverty wages even as parents, and families can't afford their care because of the public system. And we're not going to go back to a place where so many Americans are uninsured that they were scared to get testing or to get treatment in the beginning phases of this. Like I could go on and on and on and on down the list of all the ways in which our current systems failed us. And so I think that this is the moment for us to insist on rebuilding on a more, like a stronger and more secure foundation. And that's one that says, like, what do we need for people to be, for there to be equality, dignity, bodily autonomy for women and our families. And a lot of the things that we put in the demands letter are related, are COVID specific, but that would be sort of be built upon in the new world that comes after it in an ideal world. So for example, we're asking for at least 50 billion for childcare, because I don't know how these governors think they're going to reopen the economies if there's no one watching children. But that's what you get when you have lawmakers who have no idea what it's like in these positions of power. And so at least 50 billion is required just to rescue the sector. But we have an ongoing campaign with many of the partners who are also part of We Demand More to actually build that system. That means talking to the providers, talking to the parents, putting their needs front and center, lifting up the Black and brown women and the immigrant women who do this work, having parents and mothers tell the stories about what it has meant for their job stability, what it has meant for their economic security, for their retirement security, when they didn't have affordable and high quality childcare. And like, this was a problem before COVID-19. But now the campaign has taken on increased urgency and currency because people have seen what it is like. Parents across the country, employers across the country have seen what it is like, but our childcare system is broken.
And I think you've already started speaking about this, but in terms of the long stretch or going beyond the pandemic, what does this coalition look like? Given that this project seems to go beyond just sort of imminent need and really thinking about recreating economic structures, social structures, and ways that meet women's needs. Like, is this coalition going to have a lasting form beyond the pandemic?
I mean, I think it will remain to be seen. There's definitely sort of, we're in the stage right now of the public health crisis, and that will be like the stage in terms of accountability. It's not, we're not anywhere near done. But there's also there's a much bigger women's movement and infrastructure that we're tapping into that has been doing this hard work for a really long time. And so I think we'll want to imagine together what the next stage looks like, in solidarity with one another in ways that respect the existing infrastructure and build on it to get to where we need to go.
And finally, I'm wondering, for people who are watching this at home or listening into your interview and want to support the demands of the We Demand More coalition, what does that kind of support look like? What's most instrumental to your coalition?
You should go to wedemandmore.org. You can sign up there. You can sign our petition. We're trying to reach 100,000 signatories. And there's also opportunities to get involved in terms of specific actions, whether that is educating the public, whether that's calling your members of Congress or writing them letters, whether that is mask making, whether that's telling your story so that we can illustrate for lawmakers what this looks like on the ground, and how it's affecting real people's lives and the policy solutions that we need for things to be better. So there's a whole range of ways that people can get involved and be part of the solution and part of the campaign.